you're somebody who finds that your knee tends to fall into medial rotation due to posture or cellular misalignment, due to injury, due to scar tissue or adhesions in the body, then these couple of movements will be really good for you. We really want to make sure that we're helping the foot come back to the nature of being a foot. Our feet were never designed to be walking around in shoes, to be squished together, which is what happens when we put them in modern shoes, and also to inhibit the arch of our foot or the muscles of our feet. Let me explain that. Most modern shoes have an arch in the foot, meaning that the arch of our own feet can't actually flex and extend, meaning that the muscles, the 4 layers of muscle on the inside of the foot, or where the arch is, they start to collapse, and we start to see medial rotation of the knee joint, and of course that's going to wear away at the patella, starting to cause pain, inflammation, and also create blockages, and of course move into potential surgery down the track. Now, if your knee is starting to track out of alignment, I see it all the time when people are walking with medially rotated knees, then your hip joint is also going to be getting pulled out of alignment. Tending to stand in postural misalignment like this not only creates that medial knocking of the knee and a collapsing of one side of the foot, but of course we start to move into pelvic instability, and that's when we experience back, neck, and shoulder pain. So here's a couple of movements that you can do that not work with the knee directly, but work with the foot to create a balanced tripod of the foot, which will then direct the orientation of the patella. And hopefully that will help the rest of your body realign from a feet first philosophy. I'm Meg, I run Move Like Water Collective. If this resonates with you and you get something out of it, please don't be afraid to give it a like, a share, and a subscribe. And I'd love to hear from you how this helps the function of your feet. So you're going to grab yourself a juggling ball, and we're going to start, if you don't have a juggling ball, you can just use your washing. And we're going to start to spread the toes. Again, our toes should move like our fingers, and grab the ball and just pick it up and drop it back down. Now we're going to aim for this about 10 times and try to do different movements with the hip every single time. We have to remember that the hip is a ball and socket joint. All right, so it is designed to move, and if we're sitting in chairs consistently, then that's not really helping the nature of the hip move. All right, so if we're constantly here, we're going to get short hip flexors, short psoas muscle, short quads, and short hamstrings. And then we go to stand up, and that starts to really pull onto the joints, and a lot of us hyperextend, so we can end up with a lot of pain, not just in our patella and our knees, but also of course into our hips. So this is a really nice one to start to flex and strengthen the muscles of your feet. All right, by squeezing and flexing underneath you, we start to get the muscles of the feet really working, but also start to open your hips and move your hips around the joints. Okay, second to that, we want to stand on something that is a little bit unsteady. So I recommend either a half dome or a squishy yoga block for this one. So when we're working into this next one, we're really thinking about standing on something that's a little bit uneven to start to work through the stabilizers of the ankle and the patella and also the hip. We're now trying also to strengthen our glute medius to help our hips come back to balance. So we're going to stand on something uneven, tripod of the foot, so 60% into the heel, 40% into the two balls of the foot. The toes are spread and splayed, and I've got a soft knee bend here turning on the VMO, which supports the patella. All right, and then from here, what I'm going to do is just allow that hip to float, and I'm just going to start to throw the ball side to side. What's actively happening here is not only am I strengthening those muscles of the feet by being on something uneven, but you can see that my quad is starting to fire, my glute's starting to fire, and I'm getting all of this quite mobile movement with my hip here. It's just moving in any direction, playing around with some hinging. I'm never locking out at any moment here. I'm staying really nice and elastic within my body. And you'll work the right side and the left side for up to a minute each side. The third part to this one, to strengthen the muscles in the feet and also to start to get the body really nice and loose, is to again stand on something that's uneven. I'm just going to use this yoga block. I'm also on the tripod of the foot here. Now you want to have an object that you can balance on the back of your hand here. So this one we start to really involve the spine here. So we have to remember that if the pelvis is out of balance and it is moving towards like pelvic instability and we tip into one hip, if the pelvis is out of alignment, again our pelvis should be neutral and under the rib cage, what happens is the rest of the body upstream doesn't feel safe. So we start to get a lot of tension in our shoulders, we walk around like this, and we start to round in because our back doesn't feel safe because the pelvis is out of alignment. Okay, it's a big issue we see everywhere, so this is a really nice one to teach that upper body to be really nice and relaxed while strengthening the glute medius, strengthening the quad, working on the muscles of the feet, and of course practicing our breathing. So soft knee bend here, balance something on the back of your hand. And all we're going to do here is start to slowly move the ball around. Now you have a choice here. You don't have to watch the ball. And just using your peripheral to navigate this. Or you can make it a little bit more challenging by following that ball with your gaze. And this makes it a whole nother game here, especially if you're balancing on something uneven. I'm working really hard here. There's every single part of my body working, and I'm also trying to stay really relaxed to nasal breathe, so diaphragmatic breathe, which will help my nervous system stay in a relaxed and open state so that I can twist my body, I can start to hydrate through my fascia and get every single part of the body moving here, covering everything that I just spoke about. So I'd recommend going through 2 or 3 rounds of that, maybe 3 times a week. If you're looking to realign your patella and your hips, I really recommend starting from a feet first philosophy and giving that a go to strengthen the muscles of your feet, to get your toes moving again and to increase the arch strength so that your knees are now back in alignment.